There are a lot of people who have come to accept that the process of aging brings with it a variety of incurable chronic diseases, including cancers. Now, if that is you, don't lose hope. We'll be pleased to know that there's a fast-developing branch of medicine that seeks to actively manage this process, anti-aging medicine. Good morning and a very warm welcome to Bonita's House Call here on SABC 2. I'm Dr. Victor Ramathesele. Now, integrative medicine, which includes anti-aging medicine, aims to prevent and manage the effects of aging on our bodies and the various diseases associated with it. Singavani sithi nje umuntu uphethwe yi-old age noma sithi nje ushukela ne-high inhlala yenza emndenini othize noma ngokuhamba kweminyaka nokuguga komuntu. Please remember, we are not coming to you live today. Now, he's a South African specialist physician, a pioneer in his field with an international qualification in anti-aging and regenerative medicine. Let's welcome into the studio this morning Dr. Craige Golding. Dr. Craige, thank you very much for joining Bonita's House Call.
My pleasure.
Now, integrative medicine, anti-aging medicine. Can you give us a sense? What does this mean?
Sure. Obviously, as a physician, I've managed many chronic diseases over the years, qualified in 1999. Allopathic medicine, generally when you're managing chronic diseases, makes use of chronic drugs. And that is one aspect of medicine, though, managing chronic disease with chronic drugs. Anti-aging medicine is more about the prevention of all the debilitating diseases that come with aging. And about 90% of chronic diseases are due to aging and that degenerative process. For instance, osteoporosis, osteoarthritis, cancers, heart disease, diabetes, dementia. All of these diseases come on due to the aging process, hormone decline and aging and degenerative change. So anti-aging medicine is really to pick up clues about the development of degenerative disease and to try and reverse it at the most early phase possible to actually prevent the disease in the first place, rather than managing it after the case with chronic drugs.
Now, you are MBCHB Pretoria, cum laude. Now, which means you're one of those bright sparks, who got distinctions in everything that you attempted to study. Now, one would have thought that with those kind of attributes, you'd have done in neurosurgery or some of the more exciting things in medicine that really challenge you in terms of your intellectual capabilities. Why did you decide to go into this specialty, which is not even available in South Africa?
Well, I started with internal medicine. I always enjoyed clinical medicine, hands-on medicine with my clients. I was tempted to do the other disciplines that you've mentioned, even anesthetics I was also particularly interested in. But medicine has always been very challenging. It's a very, internal medicine is a very, very big field, and it's always challenging. So I started off, with internal medicine and obviously became a physician in 1999. And then over the years, practicing as a physician, I realized that what I was generally doing was, as I said earlier, managing chronic disease. Instead of making the people well, I was just managing their disease. And then, it sparked a thought in my head that there must be another way to get people well and to actually get them off their chronic drugs. And that really is what anti-aging medicine is all about. We don't keep adding on chronic drugs. We actually try and make the person well and keep them well. You want to spend a long time living healthily and a shorter time dying. None of us are guaranteed tomorrow, but you want to live your life healthily. And that includes lifestyle measures and lifestyle changes. It includes correct nutritional intake, correct diet. It includes exercise. It includes nutritional and hormonal balance and health. So it's really, just grown as I've grown as a physician, my interest in anti-aging medicine. And it does make you a more complete physician when you're not only managing chronic disease, but you're also trying to prevent disease. I think a better doctor would actually empower his client not to get ill and to keep well and to try and encourage them to stay well, obviously. And integrative medicine is really the combination of the two, preventive medicine and allopathic medicine, and using whatever tools you have to encourage health.
Allopathic is medicine as we understand it.
Absolutely.
Yes. Now, one of the major criticisms towards medicine by a lot of detractors has been, you guys do absolutely nothing. All you say is tell me that I've got cholesterol, I've got high blood, and from then on you tell me to exercise and eat properly and give me drug for the rest of my life. Now, maybe what you're doing now is an answer to some of these problems, that maybe the point would be to try and prevent actively those things from happening, more than just saying to people, go and exercise, go and manage your weight. Your comments?
Absolutely. If you're looking at heart disease, for instance, vascular disease, heart attack and stroke are still the two leading causes of death worldwide on every continent. So obviously prevention of vascular disease is of paramount importance to most people's health. And as we get older, our risk for vascular disease goes up. You have hormone decline, for instance, as your testosterone goes down, so your cardiovascular risk goes up. So keeping yourself hormonally sound will obviously lower your risk for cardiovascular disease. And when you're looking at prevention, it tends to be a lot more thorough in terms of investigations than conventional medicine. If you go for an insurance medical, you invariably have a stress ECG and a fasting lipogram, and that's your cardiac risk. But it's certainly not enough to guarantee that you're not going to have a heart attack, or to virtually guarantee that you're not going to have a heart attack. There's so many cardiovascular risk factors over and above cholesterol. For instance, inflammation and oxidative stress and homocysteine levels and inflammatory markers and ferritin and lipoprotein little a and insulin resistance and raised sugar. And there's so many risk factors to have a look at.
Now, this is quite interesting because the point that you're making is that quite often when you look at a person, we will say essentially there are certain things that happen with aging that predispose us to disease. What are these things exactly?
Well, first of all, your nutritional requirements, your vitamin requirements and antioxidant requirements tend to escalate as you get older. Your enzymatic reactions need more support, and you need more vitamin supplementation as you get older.
So there are certain things that you need to use as you age because
you need
the
more.
demands on your body is more.
The
more
aged
than
body,
just your normal diet will provide.
That's right.
Okay.
The diet, we used to think that maybe you could get all your nutrients from your diet, but you really can't. There was a good article in the June edition of the JAMA journal in 2002 where a couple of Harvard experts studied just that to see if we can get our nutritional requirements from the diet. Because some people say taking vitamins is expensive urine, which we obviously disagree with completely. You cannot get all the nutrients you need from your diet. The soil isn't rich in nutrients anymore like it was 30, 40 years ago. It's mineral depleted. The picking of fruit and vegetables already results in loss of nutrient content. The processing of food, the storage of food, the freezing of food, the cooking of it, all of that ends up in nutrient.
Now, hang on. I don't want us to confuse the matter. We know that a lot of things that have happened in the last decade or in the last generation, 30 years that is, that have led to an emergence of certain types of diseases that we did not see before, which are as a result, obviously, of technology, and as it relates to farming, as it relates to how food is being prepared, and so on and so forth. But before we come into
that's one
aging
aspect.
in itself, what demands does it put, and how does it affect?
I just mentioned that your nutritional requirements or your nutrient requirements do escalate as you age. Obviously, there's precipitants to aging, and one of the major precipitants is hormone decline. For instance, a menopausal woman loses her sex hormones. She often has adrenal hormone decline, often thyroid hormone decline. And all of these hormone declines result in accelerated aging and all the diseases associated with it. For instance, as you enter the menopause as a woman, you tend to gain a lot of weight because your fat metabolizing hormones from your adrenals, like your DHEA or your testosterone sex hormone from your ovaries declines, or your thyroid may be getting a bit lazy. So you tend to gain weight in the menopause, and you tend to get all the problems associated with the weight gain. Obviously, type 2 diabetes, insulin resistance, raised blood pressure, dyslipidemia, osteoporosis, even brain fog, depression, dementia, all as a result of estrogen deficiency, anxiety or insomnia as a result of progesterone deficiency. So those hormone declines are very important and critical in anti-aging medicine. To pay attention to.
And then, of course, all the other man-made stuff, the exposure, the pollution that we have, and all of those
we live in a very
things,
toxic environment. We think we're eating well when we eat vegetables, but sometimes they have pesticides on. We think we're eating well when we're eating fish, and they're full of heavy metals like mercury. So, we are exposed to a lot of toxins. As you mentioned.
Your approach, therefore, to this is that you try to take a patient as an individual instead of just prescribing multivitamins and say, go to the chemist and get ABC. You look at a patient as an individual. You take the history of the patient, obviously. You examine the patient to look at all the risk factors for these conditions. And then you assess the patient to look at all of these things that you say tend to decline with age, to see how much they have declined, so that you can determine how much you need to supplement some of those things. But can you explain then the concept of disease markers, which you mentioned, rather, fleetingly in the last few minutes. Now, disease markers, how do these come in, and what information do they give you?
Sure. Obviously, as I mentioned before, vascular disease is very common and still the leading cause of death. Sir William Osler said you're only as old as your blood vessels, and you are. So blood vessel health is critical in anti-aging medicine. So we do quite an extensive cardiovascular risk marker panel. And when it comes to preventive medicine, as I mentioned, it's important to check more than just your cholesterol. You want to know your good cholesterol, your HDL, your bad cholesterol, your LDL. You want to know your triglycerides. You want to know your fasting sugar. You want to know your insulin post-sugar challenge, 2 hours after sugar challenge, to see if you have insulin resistance, although that can often be assessed clinically just by assessing somebody's waist circumference. If they have a lot of abdominal fat or visceral fat, they tend to have insulin resistance. But insulin resistance is an important component of metabolic syndrome and cardiovascular disease, so we always check for that. We always check for highly sensitive CRP, which is obviously C-reactive protein. Below 1 is low risk, 1 to 3 is moderate risk, above 3 is high risk for cardiovascular disease. We always check homocysteine, product of metabolism of methionine in the liver. It's a very good preventive marker. We know that if you lower homocysteine, your risk for cardiovascular disease is decreased. We always check for fibrinogen, particularly in women. If that's elevated, their risk for their blood to clot is elevated. So we check that. And lipoprotein little a, the very dense lipid molecule that is also associated with
so there's quite a lot of things.
Quite an extensive
we'll look into the specific conditions. What do you check for a person who's got cardiac risk, who's got thyroid risk, a little bit later in the show. But having done all of those things, you have to use some products now to augment where the body is becoming deficient. And also, you also need to say, if you've got disease markers that say to you, a person could be beginning to be exposed to certain conditions, that you need to try and manage that as well. Now, the products that you use, how different are they from everything else that is available out there in the market that you've had so many people even saying they're expensive urine, like you say? A lot of people have also said a lot of the multivitamins are not properly absorbed in the stomach and so on and so forth. How specific and how unique are some of the products that you recommend, and how researched are they? Because one of the other issues is that a lot of the medications and the supplements that people are recommended to take out, they are not properly researched and are not properly registered in this country, at least.
Sure. That's a big question to answer. There's a lot of aspects you've touched on there. I think it's very important to choose your
maybe
supplements,
what
your nutraceuticals, vitamins.
Let's take an ad break, because maybe it is quite a big chunk to chew on. Let's take an ad break. When you return, you address all those questions around the products that you recommend that should be used once you've discovered what is particularly wrong with a particular patient. Customized approach, as we wish. One is, re utlwa gore na go thweng gore motho a ntse a tsofala gore ka Sesotho re ne re re go tsofala ya ratang pa ka jeno re utlwa go thwe go kula ya ratang. We'll continue our discussion with Dr Craige Golding, anti-aging specialist, hang ha re gutla ha Ramathesele. Guys, madumega a fele gompieno ga re kitla re tsaya megala ya lona ka gonne re sa tle ka tlhamalalo. Re tshwere dikgane Dr Craige Golding, moitsanape o diphatsa mo mererong ya diphetogo tsa malwetse ao a re tlhaselang ga mengwaga e ntse e tlhabela pele. Anti-aging medicine. Please remember, we are not coming to you live today, but we're having a very, very interesting discussion with Dr Golding. Now, we asked before the break, how unique, how important, how researched, how reliable are the products that we are using, and how absorbed are they, to ensure that they get to their final destinations in our bodies?
I think that is a very important question, because there's so much out there, so many different products that one can choose from. You really need to choose the product that you're going to take carefully. The products that I suggest and prescribe are well-researched, published in peer-reviewed journals, and also spoken about at academic institutions like the American Academy of Anti-Aging. I wouldn't use something that hasn't been researched or studied. For starters, you want to use a company that has good manufacturing practices. In other words, they produce good quality, high concentration extracts. For instance, nutraceuticals, we use a lot of in anti-aging medicine. Nutraceuticals are concentrated herbal plant extracts at high doses to obviously be effective as a medicine. It's a natural medicine, in fact. So you want to have a company that has good manufacturing practices. You want to have a company that is scientifically researched. In other words, the supplements that they bring out are scientifically researched. You want to make sure they use the right fillers. For instance, you can get a cheaper vitamin because half of the vitamin might have fillers in it, and you want small amount of fillers and the right amount of active ingredient. It's to keep the chemical active and absorbable.
Give it substance.
Absolutely. Okay. In the capsule. So you've got to know that it's a reputable company using the right fillers and the right form of the active ingredient. For instance, if you're going to take calcium, you would preferably want it in the calcium glycinate form because that's best absorbed. If it's in the calcium carbonate form, it's an inferior form of it and much cheaper, but not nearly as good in
Not
terms
well
of absorption.
absorbed. Yeah.
Absolutely.
It doesn't serve the purpose in the end.
Absolutely. So, it's better to pay a little bit more and make sure that the product you're taking is reliable and effective and well researched.
Okay. Now, obviously then, if you look at the products that you'd be using in anti-aging medicine, having looked at a patient, I mean, some of them will be minerals, some of them will be amino acids, some of them will be plant extracts, some of them will be
Hormones.
also synthetic hormones. What else? What are the other methods and what are the other sources of products that you use in an individual?
Okay, well, you've mentioned obviously the diet is very important, as we mentioned before. So your macromolecule intake, carbohydrates, fat, protein, water, that's all very important. And then your micronutrients are just as important. Your vitamins and minerals, as you've mentioned, nutraceuticals, which is obviously herbal extracts. We use a lot of that. For instance, just as an example, a turmeric extract we call curcumin. Nice high concentration of turmeric extract. Brilliant anti-inflammatory, brilliant phase 2 liver detoxifier, good cancer fighter. So it's a brilliant nutraceutical, and we make use of it a lot in anti-aging medicine and other nutraceuticals. We obviously use a lot of hormones. You mentioned synthetic hormones. We use bioidentical hormones in anti-aging medicine. In other words, hormones that have exactly the same molecular structure as the hormone occurring in your body. The irony is that they are synthetic. They're synthesized in a lab from plant origin, but they synthesize to mimic the exact structure. We found that they're much better tolerated with fewer side effects when the hormones replicate the structure that occurs in the human body. So we use a lot of hormones in our therapies, particularly when the hormones start to decline. So, for instance, progesterone starts to decline after the age of 28 in a woman. So often in their 30s, they might need a bit of progesterone in the second half of their cycle. Around the menopause, obviously, progesterone is deficient first, then estrogen, and then obviously testosterone as well. If your ovaries fail, testosterone is often deficient. And then often, there's adrenal fatigue or adrenal stress with low DHEA and high cortisol, sometimes insulin issues, sometimes thyroid issues. So we check all of those hormones and we replenish what you depleted in. With aging, we generally see that insulin and cortisol start to rise. And insulin and cortisol are bad for you. Those are the two hormones you want to try and keep down. And we have various products that we use to do that. For instance, you can improve your insulin sensitivity not only with the low glycemic index diet and exercise, but you can also use nutraceuticals like chromium or alpha-lipoic or EGCG, a green tea extract.
So that will improve the insulin sensitivity,
lower your
the chances of diabetes and many other conditions
Absolutely.
associated.
Diabetes, cardiovascular diseases, or disease and all the associated
But maybe at that point then, what about a patient that confronts you? Because we would imagine that although you see most patients who already have a particular condition, which is unfortunate because ideally you'd want a patient to come to you before they suffer from any chronic condition, as it were.
It's easier to reverse, obviously.
It's easier to reverse,
the sooner you pick it up.
Now, what about a particular patient will determine what tests you're going to perform? Because from what you're saying, there are millions of tests that you can perform,
Absolutely.
and there are millions of preparations that you can recommend to an individual.
Absolutely.
What determines what you are going to do and what you are going to give to a particular patient when they confront you for the first time?
Okay. Just as with conventional medicine, I think the history is the most important element to evaluating the person. You want to know what their aches and pains and gripes are. And you want to know all these associated symptoms with hormonal imbalances and with nutritional deficiencies. So the history is of paramount importance to establish what underlying problems there are. And that will refine your blood workup and what kind of tests you're going to do. We do a lot of other tests as well, not only blood tests. We check for neurotransmitter levels in the brain by measuring urine metabolites. We check for heavy metal toxicity. We're exposed to a lot of heavy metals in the environment, like mercury, aluminium, lead, antimony, nickel, copper. We exposed to these heavy metals, and they cause a lot of problems. Cardiovascular disease, for instance, from mercury. Aluminium has been associated with Alzheimer's dementia and obviously neurodegenerative problems. So we do quite extensive lab work. We also do saliva testing, for instance, to check tissue levels of steroid hormones. We often do 24-hour urine steroid chromatograms to check metabolites of hormones. It's very important for breast cancer prevention, for instance, to have a good 2 to 16 hydroxyestrone ratio in your urine, between 2 and 9. The higher your 2 hydroxyestrone, the lower your risk to develop breast cancer. So when we're using hormonal therapies, we often check for metabolites. And, the lab testing is unfortunately expensive.
Yeah.
But when you look at the cost of a heart attack and a bypass, for instance, I mean, that's a couple of R100,000.
Yeah, the laboratory tests will pale into insignificance.
Absolutely. You're going to pay 2,000 or 3,000 rand to have your blood work up for an anti-aging assessment, but it's well worth it to know what your problems are before they manifest as a disease. It just makes so much more sense to pick things up early and try and keep
Okay, now let's take a typical case now. If you're confronted with a patient who who is an established hypertensive, mid-40s, early 50s, established hypertension, little bit of cholesterol, beginning to misbehave, a male patient in this case, and maybe has been encouraged to exercise and to manage their weight, and they are on the first line of drugs for hypertension. Maybe in our case it would be a diuretic, a hydrochlorothiazide, and maybe a statin, just to manage the cholesterol levels. What kind of tests would you do, and what are the likely outcomes, and how do you deal with the commonest outcomes that you find in a patient like that?
Okay, there's two aspects I'd like to touch on there. First of all, when you're sitting with any chronic condition, or any medical condition, it does make a lot more sense to try and find the cause of that condition rather than managing the symptom with a drug. So if you have elevated blood pressure and you give a blood pressure pill, that is one approach, and that is generally the approach that us Westernized doctors take.
That's what we're taught.
That's what we're taught.
Yeah.
However, if you can find a cause for the blood pressure, let's say there's atherosclerotic blood vessel disease or left ventricular dysfunction as a result of ischemic heart disease, or there's adrenal stress as a result of a stressful life and
but it's a
poor
small
nutrition.
percentage, isn't it?
It's a small percentage,
Yeah.
but if you can, you need to assess to try and find a cause for the blood pressure. Obviously, the secondary hypertensions, we trained how to diagnose those, endocrine disorders, chronic renal failure, parathyroid problems, calcium problems, all of that, pheochromocytoma. I mean, we know how to investigate, or most physicians know how to investigate for those. I'm talking about the other causes that aren't really checked for in conventional medicine, that we check for in anti-aging medicine. These include things like heavy metal toxicities, chronic stress that hasn't been addressed, adrenal fatigue or adrenal stress, abnormal hormone ratios, and so on. So we check for all of that, and we obviously try and correct that. And what you find is if you do correct adrenal stress and you do fix the blood vessels, for instance, if there's atherosclerotic calcific plaques and you chelate them with IV EDTA or oral EDTA, plus other things like vitamin K2, MK7, which actually reverses that calcium.
The blood pressure drops when you do those
blood
things.
pressure drops, and then you can actually get people off
some of the
chronic
medication.
hypertensive.
Pharmaceutical companies are not going to like you very much. Eh?
Look, I'm not anti-drug. I make use of drugs.
Yeah,
If somebody's blood pressure is 180 over 110, I'm going to make use of an antihypertensive. The point I'm trying to make is it does make more sense to try and find a cause, because you will be able to get them off their chronic medications in the long run if you do find a cause.
But what is important is that you're not saying the methods that you use are a substitute for drugs that are often used. What you're saying is that first, they can deal with some of the unwanted and side effects that come with those drugs, and also you could use them in conjunction so that the doses of some of those drugs that you're using can actually be reduced.
Absolutely.
To the benefit of everybody.
There are some, absolutely, I agree with you. There are some alternatives to drugs as well. For instance, if you wanted to use an ACE blocker, if you wanted to use a natural medicine instead, there are things like fish oil and alpha lipoic acid that are natural ACE blockers. There's natural diuretics like taurine. There's natural beta blockers like hawthorn. It's natural calcium antagonists. So you can use natural medicines as alternatives. But I'm not saying every person needs to be on natural medicine, not allopathics. We still make use of allopathics. The important thing I want to mention, though, with the drugs, the chronic drugs in particular, is they do cause micronutrient depletions, and they do cause problems. They do have side effects. There isn't a chronic drug that doesn't have potential side effects. For instance, you mentioned the hydrochlorothiazide and the statin for somebody who's got hypertension and dyslipidemia or hyperlipidemia. For instance, the thiazide diuretics, they deplete your body of coenzyme Q10, which is very important for ATP production and very important for muscle and heart health and brain health. They also deplete your body of electrolytes, of potassium, magnesium, zinc, and so on. So, all of these things need to be replenished if you're going to, or need to be checked if you're going to prescribe a diuretic. Statins are obviously a group of drugs that have done extremely well in conventional medicine.
The biggest drug, the biggest seller at the moment, the biggest drug seller in the world at the moment is the statin.
Absolutely, but they cause severe coenzyme Q10 depletion in your body, and that's what causes the muscle pains and the muscle aches, and eventually even can result in a cardiomyopathy or heart failure as a result of coenzyme Q10 depletion. So when a patient is on a statin, I tend to supplement with ubiquinol CoQ10. That's the best form of coenzyme Q10, the best absorbed. And they do very well. You obviously want to keep an eye on their liver function. So when using chronic drugs, you just want to make sure that your micronutrient depletions caused by that drug are replenished, and you want to make sure that the other potential side effects are checked for. And obviously, it's really nice having the tools, and we're not taught that in medical school about natural medicine, but it's nice to have the tools of an allopathic library of drugs plus all the natural medicines, and taking your best combination, for that particular
But can our
person.
stomachs take this? I mean, if you look at a typical patient taking all of these micronutrients and the nutraceuticals that you're talking about, I mean, it's quite a few tablets. Some of them is up to 11, 12 tablets a day. You have to take that over and above a statin and this and this and the other. Isn't that overloading the stomach a little bit where you could get a little bit upset?
Well, I think, if you divide your tablets up during the day, it doesn't tend to be too bad. I think people can go overboard. I think, just like there's drug interactions, polypharmacy, when you're more than 7 or 8 drugs, I think, similar things can happen with natural medicines. And also natural medicines and pharmaceuticals can interact. For instance, if you use stimulating herbs, like Panax ginseng or, licorice, for instance, in adrenal stress and burnout formulas, they can actually elevate your blood pressure. If you're using St. John's wort for depression, it may alter your oral contraceptive therapy dose or your antiretroviral dose. So there are drug and herb interactions. You've got to be aware of.
So for you, it is important to know what else the patient is taking.
Absolutely.
And even if it's not the drugs, what else they eat, because all of those things can have interactions with what they take.
Absolutely.
Now, it does look like, from what you're saying, just about any condition that we are dealing with today, whether it is hypertension, diabetes, it is cholesterol, thyroid disease, mental disease, in some way, there is a role that anti-aging medicine can play. In a general sense, then, without really moving into specifics, what is the relationship between anti-aging medicine and cancers? I want you to talk about that as soon as we come back from the break. When we return, we'll continue our discussion with Dr. Golding, anti-aging medicine specialist. Welcome back. You're watching Bonita's House Call here on SABC2. And today we're talking to Dr. Craige Golding, Managing Director of Integrative Medicine Center here in Johannesburg, in Gauteng. Now, Dr. Golding, I'll ask you a little bit before the break, the relationship between your approach to medicine, which is anti-aging medicine, with cancers. By that I mean, how do you use it to prevent certain cancers, and how do you use it to prevent maybe the progression of certain cancers and maybe the management of certain cancers? I'm sure there's a role to play there.
Sure, look, it's a big field, and I don't want to take up all the time on cancer, but let's just touch on a few of them. We know that the hormonal cancers are the most frequent, or one of the most frequent cancers. So in a woman, breast cancer, and a male, prostate cancer. Those are very important cancers to try and prevent. 70% of men have prostate cancer by the age of 70, and 1 in 7 women are getting breast cancer. So those cancers are very important to look at, and we do. In my practice, we make a concerted effort to try and prevent these cancers from occurring. For instance, prostate tends to occur as your testosterone level falls and as your estrogen level goes up or your dihydrotestosterone goes up. So it's actually induced by dangerous estrogen metabolites or dihydrotestosterone, not by testosterone. It's actually when your testosterone goes down that prostate cancer goes up.
So it's not something that we should just accept that when men age, there's a good chance that they will get prostate cancer.
No,
there are changes that happen in the body as a result of aging that can be reversed.
Absolutely. One of our mottos is don't get sick, don't get old, and don't die.
Yeah.
So we don't want to wait for those sicknesses to happen. We want to be proactive and prevent them. So with prostate, for instance, we will want to make sure that your testosterone to estrogen ratio is healthy, that your testosterone isn't declining, and that your estrogen level isn't going up too high, in a man, that is. And then obviously there are nutraceuticals like indole 3-carbinol and indole-methane DIM, which help you metabolize your estrogen in a healthy fashion to 2-hydroxy, as I mentioned earlier, rather than 16-hydroxy. So we use that in our prostate protection formula. we being Salol. We have a prostate protection formula containing R3C and DIM, which helps you metabolize your estrogen. Also contains lycopene, which is a tomato found in tomatoes, also very good to protect your prostate, and selenium. And also pygium, which is a natural 5-alpha reductase inhibitor, which stops your conversion of testosterone to dihydrotestosterone.
Can you do the same for breast cancer?
We can do similar things. We have a complex called R3 complex, which has got R3C and DIM in to help you metabolize your estrogen properly, and also curcumax, which is curcumin, to help you eliminate those estrogens by phase 2 detoxification in your liver. So that's a very good formula in terms of prevention. I just want to mention another vitamin that's really come out the last few years to be hugely beneficial, and that's vitamin D3. We're finding about 80% of South Africans are deficient in it. And simply supplementing vitamin D.
But that's impossible. We have so much sunlight in this country. Why would we
well,
have a
I think
deficiency
people
of
are
vitamin D?
slightly paranoid about skin cancer. They wear sun blockers. They spend a lot of time indoors. In fact, the last 100 people that I've checked, I've got it from the laboratories, close to 90% have actually been deficient.
In South Africa?
Yeah.
In sunny South Africa? You
In
learn
sunny
from
South
Somsky.
Africa. And even in Australia and New Zealand, they've done studies over the last few years.
And what are the
confirming
dangers
deficiency.
of having a low vitamin D?
Well,
particularly
a lot of dangers. You know, we used to think at medical school I was taught that vitamin D is good for your bones. You know, it prevents osteoporosis
Still
and
is,
osteopenia.
You're not going to change that one.
Absolutely. And
But
it
there
is.
are other things.
There are a lot of other
things.
things. It's a major breast cancer reducer. It's a major colon cancer reducer. Good to prevent prostate cancer, good to prevent lymphoma. So it's a good cancer preventer. It's also very good to prevent autoimmune disease. There's some trials that have come out that show that it's good to prevent MS.
Multiple sclerosis.
Multiple sclerosis. A lot of areas of the world that don't have much sun, like Canada, for instance, have a very, very high incidence of MS. So it looks as though vitamin D has
So
a
can
big
you
role to
correct
play
for
there.
this deficiency?
Yes, we supplement. You know, we were taught at medical school that 400 IUs a day is the recommended dose. We know now that that's far too little. We prescribe somewhere in the region of 2,000 international units, 1 to 2,000 international units a day. And you can go up often quite safely to 5,000. Some of my colleagues in the States are using 5,000 international units a day. It's also very important, vitamin D, to prevent autoimmune disease, which is another interesting finding. So vitamin D is a very powerful vitamin to prevent cancers. Obviously, you want to detoxify yourself well, so you want good liver support, your liver being one of the major detoxifiers in your body. I'm talking about cancer prevention now. And then, you know, vitamins like folic acid, for instance, are extremely beneficial. A high fiber intake, we have invisible fiber, for instance, to help protect your colon. So there's a lot of preventive measures, not only lifestyle, but also with supplementation that you can lower your risk for cancer.
But once a patient has been diagnosed with cancer, is there anything that you can do using your approach to manage that, to limit the spread?
Yes, look, we have a lot of treatments specifically for cancer, you know, for metastatic cancer. And I have a number of clients in my practice now who've had chemo failure, or chemotherapy hasn't worked, and now we're trying these alternative therapies with varying amounts of success. For instance, one modality is intravenous vitamin C. When you have cancer, a small dose of vitamin C is actually of no good. In fact, it will probably be more harmful than beneficial to take 2 or 3, 4 grams of vitamin C a day in terms of supplementation, because the cancer cells will live off that. You need massive doses, we're talking 60 to 100 grams at least twice a week intravenously to cause apoptosis of those cancer cells. The cancer cells actually pop. And they're getting amazing results in the States. There's a Dr. Sherry Lieberman who I've been following with her vitamin C approach, and really amazing results with metastatic cancer. So vitamin C is one option. There are other things as well, like intravenous laetrile, which is vitamin B17. Also a new therapy that we're now making available in our center has been shown to be beneficial for most metastatic cancers. So that is something that we're looking at. Also intravenous DMSO. So there are, you know, Ukraine is another natural sort of type of chemotherapy. So there are therapies that we have
that we can use to manage it.
Use.
Sexuality and anti-aging, I mean, it's almost a foregone that with the passage of time, as people age, that sexual function declines.
Yeah, look,
I would suspect that this is an area that you address quite often as well.
It really is, particularly amongst men. You know, men don't like to go to the doctor. But I tell you, if their penis isn't working and they have erectile dysfunction, they tend to go and see the doctor.
Either they'll go to a doctor or they'll go to somebody.
They'll go to somebody.
There will be some intervention, yeah. Okay.
So we do, you know, we take a look when some, and I get a lot of men with erectile dysfunction, sort of 50, 55 plus. And it's usually due to either vascular problems, so atherosclerotic blood vessel disease, or endothelial dysfunction. So you have to fix up their blood vessels often. So
you do tests that can actually determine that.
Yeah, look, we do a cardiovascular assessment. We check for microalbuminuria, and obviously fix up the endothelium. We have some good products to do that. As I mentioned before, vitamin K2, MK7, and arterial cleanse and defense. natural anti-inflammatories, fish oil. You can clean out the blood vessels quite nicely. Even intravenous chelation or oral chelation is also one possibility for diseased blood vessels. You don't have to have a bypass if you have coronary artery disease. There are alternatives. So fix the blood vessels. And then hormone assessment is critical. Often they have the male hormones that we check are testosterone, DHEA, and androstenedione. They often have deficiencies there. Or they have a raised estrogen level, because as you get older, you aromatase more of your testosterone to estradiol, so they may have a high estradiol and a low testosterone. That can be fixed. You can stop that conversion by using an aromatase inhibitor, like Crizin X or Arimidex. Arimidex is an allopathic. Crizin is the natural alternative. And then obviously you'd want the DHEA cortisol ratio good, so your high DHEA 15 times more than the cortisol value. Often with aging, the cortisol goes up, the DHEA goes down, and as a result of that stress, your other hormones are affected and you develop erectile dysfunction.
Quite interesting. Now, let's take another look now. When you look at the way we live our lives today, I mean, there's a lot of processed food that we eat. But particularly, I want us to talk about fried and fried food. Even open flame food that we enjoy so much. I mean, the festive season, this is what we'll be doing throughout. What dangers does this pose? What specific dangers does this type of preparation pose to our systems, and how can it be managed, if at all, using your methods and approach to medicine?
Yeah, it is a concern. Obviously, the more char-grilled it is, or the more sort of black the meat is burnt, the worse for you. Obviously, increases your risk.
That's bad news for me. We were loving my braai vlees. Now, this is really bad news. So it's not good?
It's not good. You'd want to eat it more rare if possible.
Okay.
If you are going to eat it, the first thing you would want to do is lower your risk of cancer, because there's dangerous chemicals in the char-grilled meat that does affect you in terms of cancer risk. So eating it with a bit of broccoli already helps, because you get your cruciferous vegetable extracts, R3C and DIM, which protects you from cancer.
So you're not saying we should not braai our food, but if we do, we must be aware of the dangers, and there are certain things that we can take to mitigate that danger?
Absolutely. So okay. R3 complex, for instance, is a good thing to take, or eat broccoli with it. The other thing is homocysteine elevation. Okay. Homocysteine does go up with braaiing food. So check your homocysteine level. And
homocysteine level can have detriment to the cardiovascular system.
Yeah. And then also we've got benfotiamine, which is a very fat-soluble form of thiamine. Also protects you from grilled food. So there are options.
So all is not lost.
No.
We'll continue our discussion with Dr. Craige Golding after the break. Welcome back. Ngwaneso re sa tswela pele go tšhesala komo le phula lešetla le meetlo rona a bohlokwa mona Operator's House Call go SABC 2. Le nana le tlisetsang ngaka ka tlung. Dr. Golding, now we spoke about many things today, and obviously with the time we have, we are not going to cover every aspect of what is obviously a fast developing and exciting subject. Now, clearly from what you are saying, examining pregnant women, first looking at some of those infections that could be subclinical or that we may not be aware of that might have a detriment to the outcome of the pregnancy. I'm talking about HIV and AIDS and some of those things that we check, including German measles and including syphilis. We also check on them, their blood levels, look at whether they are anemic or not. And obviously in this country, we still give them almost every pregnant woman folic acid as well as iron tablets. Now, clearly from what you are saying, we are not doing enough, in terms of what we should be doing for pregnant women and the supplements that we should give them. Your view quickly?
Yes, I think, iron and folic acid have been shown over the years to be of great benefit. Folic acid definitely helps prevent neural tube defects, and obviously if you've had multiple pregnancies, you're more prone to iron deficiency. So using those two is of paramount importance. I think omega-3 supplementation is also very beneficial, particularly to the baby. The IQ of the baby tends to be, I read an article, about 10 higher in women who take omega-3 during their pregnancy.
Gee, man, I wish my mother had taken that.
Also, the DHA, docosahexaenoic acid, the DHA omega-3 is very good for brain development. So supplementing with that is very important. And in fact, even Mother Nature knows that, because breast milk is very rich in DHA omega-3. In fact, it's the richest source on the planet of omega-3 is breast milk. And breastfed children have a higher IQ than non-breastfed. It's the same reason. So fish oil is a good one.
So there's much more that pregnant women should be taking than just
vitamin D is a good idea again, because so many people are deficient, and that's a good thing to supplement as well. You can consider calcium and magnesium for in childhood for but I mean, not really so important during pregnancy. I think the omega-3 together with your iron, folate, vitamin D, those would be what I would.
What, in your view, has led to what we've seen in recent years, certainly in the last decade? Lots of young people, young women presenting with cancer of the breast, which never used to be that common among young people, and also quite a disturbing number of young people who are developing cancer of the colon,
Yes.
or of the bowel. What is your view, and how can that be addressed, using your approach to medicine?
Sure, I think there's a lot of reasons for the increase in breast cancer. One of the reasons is that we expose to a lot of what is called xenoestrogens, which are artificial estrogens, which overstimulate your estrogen receptor.
Where from?
From exhaust fumes, from sources, plastic in the supermarkets, from the farmers feeding their chickens estrogen and growth hormone. Even the cows, some of the cows are fed bovine growth hormone to make them grow quicker. So we are exposed to these estrogens in our diets and what we breathe in and what we work with, the supermarket, the plastics and so on. So we're getting these xenoestrogens which cause overstimulation of the estrogen receptor. There are a number of other things as well. When you have estrogen dominance or too little progesterone, too much estrogen, then there's also an increase. And I think a lot of usage of synthetic hormones that differ in structure to your body, I'm not going to mention names, but those synthetic hormones that differ markedly in molecular structure to the hormones that occur in your body have been shown.
And for bowel cancer, what are some of those things that are at play?
There's obviously a genetic predisposition, just like with breast. Colon, there is a genetic predisposition. So you can do what we call SNPs, or single nucleotide polymorphism studies, to see what your risk for colon cancer is, to see if it's higher. And then you would obviously want to make sure that you up your fiber intake, your folic acid intake, because these two are often depleted in colon cancer patients. And also the diet is critical. You want to have a lot of fresh fruit and vegetables, and not so much of the briflace that we were talking about earlier, because it does increase your risk for cancer.
Tell us about the artificial fiber
and then
that
also
you use.
the pesticides and the toxins and the poisons that we're all exposed to. They all increase your risk for cancer. So you've got to detoxify as well, and also don't put rubbish in your mouth when it comes to eating.
So the way to address this, therefore, is that for those people who have a strong family history, they need to start looking at some of these deficiencies that might be beginning to play up early in their lives, and addressing them with some of the medications that you've mentioned.
Absolutely. Lifestyle can overcome your genetic predisposition. You don't have to. A lot of them. There's some recessive genes that you can't overcome, but a lot of your genetic predisposition can be overcome just by lifestyle measures, correct dietary choices, exercise, correct supplements for your predisposition to overcome it. For instance, if you have a methylation problem in your liver and you're not methylating methionine, you're going to have a high homocysteine, and you're going to have an increased risk for Alzheimer's dementia later. And then you could supplement with methyl donors like folic acid or B6 or B12 or TMG or SAMe or any methyl donor that will actually lower your risk.
A lot of these things, isn't it? Okay, now, and I was just asking you earlier now, the invisible fiber that you recommend for those people who might not be taking enough roughage and fiber in their diet, how does that work?
Most of us aren't. To get 45 grams of fiber in a day, you're going to have to eat your non-veg and fruit, and most of us aren't. It's just difficult. We have difficult, busy, stressed lives, and we're not getting in enough of those foods. And as we mentioned earlier, the nutritional quality of them isn't as good as it was before anyway. So we do recommend fiber supplementation. Almost acts as a broom, cleans out the colon very nicely, lowers your risk for diverticular disease.
And you prescribe that in a powder form?
You just mix it with a bit of water once or twice a day, and it works like a bomb.
Mental health and anti-aging?
We do a lot of neurotransmitter testing. We test for urine metabolites. We send it off to the States at the moment. We are negotiating with the labs to make tests available here. But you can assess the chemicals of the brain, the neurotransmitters, rather than just blindly prescribing an antidepressant or an anxiolytic when those symptoms arise.
But we know that in depressed patients, there are a lot of these neurotransmitters, dopamine and the
Absolutely,
others.
Dopamine, noradrenaline, serotonin. You need to know where your deficiencies are. Also, when it comes to anxiety, you'd want to know where your excitatory chemicals are, like phenylethylamine and glutamate. You want to know where those chemicals are. You want to know where your GABA system is. Often with recreational drug use or alcohol use, your serotonin or dopamine or GABA receptors can be damaged, and that results in anxiety.
So in a nutshell, you're saying there's a role that anti-aging medicines can play in the management of depression, in the management of anxiety disorders, certainly in the management of some of the psychotic disorders, schizophrenia and major depression, and even maybe hyperactivity disorder, attention deficit?
Absolutely. We assess all of those patients, starting with the neurotransmitter assessment. For instance, if you've got low dopamine activity, you'll have low metabolites in the urine, and then we use tyrosine together with B vitamins, B6, for instance, to enhance your own dopamine production. With low noradrenaline, you can use phenylalanine. With low serotonin, you can use 5-HTP or St. John's wort. With low GABA, you can use gabapentropin. With high glutamate, you can use theanine, a green tea extract, to suppress that.
Sure,
For
a lot
AD
you can use, eh?
Yeah, for
Singabawa,
ADD.
ngiyacacisa ukuba nenza i-test ukwenzela ukuthi nithabathe amayeza afaneleyo ukunqanda ukuchala nokucothisa izigulo ezihambisana nobudala. We'll continue and round up our discussion when we return. You're watching Bonitas on Score here on SABC2 and welcome back. Now we've really covered a lot. I think in 1 hour we could have covered much more. And certainly we'll be inviting you again to give us a little bit more about the developments in this rather exciting branch of medicine that is fast developing as well, as we said, which is anti-aging medicine. What are your final comments that you want the viewer out there to take from the work that you are doing?
Okay. Well, I think, first of all, the term anti-aging is a bit misleading because a lot of people interpret that as being aesthetic medicine or Botox medicine, fixing up the way you look in terms of wrinkles and so on. It's a much, much bigger field than that. It's a new discipline in medicine. It's going to be a discipline in medicine like internal medicine and like surgery is. They're waiting for recognition of it in the States. It should take another couple of years and then it will be a sub-discipline. I believe it's the future of medicine, as do most anti-aging doctors in the States. It certainly makes a lot of sense from just looking at the model. It's a wellness-based model where we treat the cause and make you well and keep you well, rather than a disease-based model where you diagnose a disease and manage those symptoms or band-aid those symptoms with a chronic drug. So the model is much better. The mental thinking behind it is a lot better. It makes a lot of sense to treat the cause rather than just manage the symptom. So I think it is the medicine of the future. I think it is very important to know that this kind of model of medicine, you as an individual have to take care of yourself. You have to take power and control of your own health. And through the help of your doctor, your anti-aging doctor, get correct nutritional assessments, get correct hormonal assessments, get the correct supplements, as we discussed earlier, the right researched ones, manufactured with good...
custom made to you.
Absolutely,
you don't walk into a chemist
absolutely.
and say, I'm looking for multivitamins.
You can't. You need to have an assessment to know where your hormones are and where your nutritional status is. You need to know what you depleted and what you need. Everybody's requirements differs. It's not a one-size-fits-all approach to anti-aging medicine. It's an individualized treatment that you use in conjunction with lifestyle to sustain your health. And it can be done. And a lot of my clients have, they send their distant family from overseas, wherever, because they feel so much better. Their vitality is back and their health is back.
What is the final comment? If people say these things are expensive, what would be your comment?
Being sick is more expensive, and I'd rather be healthy. Pay for your health now or pay for your sickness later. It's as simple as that.
And once you take them, are you going to take them for a lifetime or are you going to stop at some point?
It's going to vary. If you change your lifestyle and your cholesterol comes down because you've cut out the meat and dairy, you may be able to get off your cholesterol-lowering supplements. Things like fish oil, I think everybody should be on indefinitely. It's so good for your heart and brain and joints and skin, vascular health and general health that everybody should be on it. Things like resveratrol, grapeseed extracts, those kinds of supplements, vitamin D, you're invariably on for a long period of time. Vitamin D can take 18 months to normalize before you can stop it. But a lot of them are maintenance-type programs, particularly the hormones. Once you're menopausal, your ovaries ain't going to start making estrogen again. You may need transdermal estrogen ongoing, depending on your situation and or contraindications and or cancer history in the family.
Would I be correct to say if any one of us came to your rooms for an assessment, we'll come up with something to take?
Absolutely. I don't know anybody who's 100% nutritionally and hormonally sound without any medical problems. Everybody's got some kind of problem. Even if it's just stress, there's always something that needs to be managed to enhance your
And
health.
at what age should one start taking anti-aging medicines?
In utero.
Oh, no. So anybody, a
That's
child...
ideally.
Because we do give multivitamins to children, actually, for a variety of reasons.
Absolutely.
And sometimes to stimulate appetite, which
Obviously,
is wrong.
you need more the older you get. But there is no youngest age to start. I think
Dr.
everybody
Craige
should
Golding, from the Medical Director of Integrative Medicine South Africa, thank you very, very much for having joined Bonitas. Certainly, we'll call you again to expand more on this rather exciting branch of medicine. Anti-aging medicine, an easy-to-apply formula to ensure that we spend a longer time living healthily and a shorter time dying. Don't forget to visit our website on www.housecall-easy.co.za to get more information on this show. And please remember that you can obtain a DVD copy of any of our shows by ordering through this website or calling Johannesburg 285-6180. We'll be back next Saturday with another informative show. So don't miss it here on SABC2 at 11:30 in the morning. Msingabao yanga nangomso. Makube khosi kube hele. Arikopaneng hape picking Tato Hailemre. Thanks for joining us today. And from me, Dr. Victor Ramathesele. Iya kaula yaya namani setla mutangwa mletsana. Hi Papa Atwe. You take care. Wellness, if it becomes part of wellness, I think we'll get somewhere. You must also, we need to speak quickly because there's a health expo that is going to take place in, I think my wife's company is doing that, but I think they must just speak to, in Johannesburg, the first one, the first health and wellness expo. So, yeah, so it would be important for you to partner with that in some form, yeah. And actually have people who can demonstrate, who can talk, video. Dumelang, I'm Dr. Victor Ramathesele. Join me this Saturday as we make another Bonita Sounds Call with Dr. Craige Golding on SABC2 at 11:30 in the morning.